parents. This is one question that every parent in their pregnancy period, as well as when the newborn is home, does have in mind. So, Dr. Vrushali, welcome.
Thank you so much, Seema. So being a new parents is the most happy feeling. Parenthood journey starts now, but it is sometimes associated with mixed feelings as well, like in the form whether I'll be able to carry this parenthood properly or not. So don't worry, here I am today. I'll be discussing about the newborn care even at home and from the start of the birth of the baby. I'm Dr. Vrushali Bichkar. I'm a consultant neonatologist and pediatrician at Motherhood Hospital, Newlanagar, Pune. So let us start with subtle aspects regarding especially the feeding, which one should always know. Most of us are aware that mother's milk is the most important milk for a newborn baby to have, and we need to start as early as possible. Being new parents, sometimes the mothers might think that there is no milk flow to begin with when we put the baby to latch onto the breast within an hour of birth, which is definitely very, very important. Do not worry, in the initial 2 days, it's going to be certain amount of milk, but that's going to be cholesterol, which is got very rich in immunoglobulin properties. So that's being the first vaccine for your baby. Do start this journey as early as possible post delivery and continue this breastfeeding journey every 2 to 3 hours in the next few days of life. Your baby is going to lose certain amount of weight every day, so do not panic if the discharge weight of the baby is less than that of the birth weight. As expected, the babies do lose around 1 to 2% of the birth weight every day till the next 3 to 5 days of life, and later on, the weight gain phase starts in the baby. So, the discharge weight can be low as compared to the birth weight. Many a times the myth is that let the baby cry and then only feed the baby. It's absolutely not true. We need to pick up the baby during the early feeding cues, which is like if the baby is rooting, sucking onto clothes, or if he's having some sounds which mimic like sucking onto the breast, or if he's searching for the mother's milk. Definitely start feeding during that time and don't let the baby completely cry and then only take the baby and feed. Okay, there are various social medias wherein you can actually get a proper positioning and latching, how it should be normally. Many times the question arises that one breast the baby is taking nicely, the other breast the baby is not able to take that nicely. So the reason can be there are different positions. So the baby may be comfortable in a single position on one breast, but he may not be comfortable with the second breast in the same position. So you can actually change the position of the baby and try breastfeeding on the other side of the breast. I want you to feed the baby on one breast at a time and then later on give the other breast the next time. The reason being that when the milk flow starts from one breast, initial milk is watery in nature and the remaining milk is rich in hind milk, which is more of fat content. So let the baby finish one breast completely for at least 10 to 15 minutes and then only switch over to the next breast. Or maybe at 10 o'clock if you're fed on the left side of the breast, then you can go for at 12 o'clock on the right side. That's because your baby needs to receive good amount of watery milk as well as the hind milk, which is rich in fat. Regarding weight, I have as discussed. After 3 to 5 days, the baby is going to start gaining weight nicely, and he's going to reach his birth weight by approximately 7 to 10 days of life. After that, it is very much safe to be shifted onto on-demand feeds, wherein the baby decides when the baby wants to feed. So you don't have to wake up a sleeping baby every time to feed the baby. But yes, definitely before 7 to 10 days of life, you need to give 2 to 3 hourly feeding. Many mothers they actually suffer a lot, like in order to wake up a sleeping baby. So these are subtle tips which I want to discuss with you. While waking up a sleeping baby, you need to have a cozy room wherein you are opening up the baby's clothes, gently giving a massage to the baby's back, as well as gentle stroking of the soles can be given. Let the baby come out of the sleep completely and then put the baby onto the breast. The baby will suckle onto the breast for a longer duration. There are many questions which come across to new parents with respect to urine frequency, stooling pattern of the baby. So, regarding urine, the frequency is going to slowly increase. So, if your baby is 3 days old, the minimal urine frequency needs to be around 3. As the day is going to advance, the baby is going to increase the urine frequency. By the end of first week, the baby will pass around 6 to 8 times urine every day, including day as well as night. Regarding stooling, initial 2 days it's going to be blackish green stools, which we call it as meconium. Later on, it's going to go into a transition stool, which is greenish yellow in nature, and from 4 to 5 days onwards, it's going to be yellow stools, which are the mature stools for a baby. Breastfeeding journey needs to be continued completely till completion of 6 months of baby's age. No giving right water, no giving honey, no other prelacteal feeds to be given to the baby. It needs to be completely breast milk. Water, does my baby need more water? The answer is no. Even during summer season, you don't have to give extra water to the baby till 6 months of age. That's because the breast milk is enriched with water. Around 70% of the breast milk is water contained. So, no extra water to be given. Regarding temperature maintenance, many of the parents they are worried. If my what if my baby gets cold? So the best method is to check the baby's chest by your dorsum of the hand and also the palms and soles of the baby. If you find any temperature difference, like if the chest is warm and the palms and soles they are having cold stress, then you can have use of mittens, socks, and maybe one extra wrap to the baby. बहुत ज़्यादा रैप करने की ज़रूरत नहीं है, स्पेशली ड्यूरिंग समर सीजन. If you give 2-3 wraps to the baby might feel very hot and the baby might get cranky also with lot of sweating. So it's based on baby, how the baby is receiving the wraps. With the check of this temperature, you can get to know how much wrapping the baby needs. Definitely. Regarding bathing and massage, bathing can be started earlier, but I normally recommend to start bathing once the cord is fallen off. That is around 7 to 10 today. Before that, you can just sponging. Once you start bathing, definitely oil massage is recommended. Any particular brand of oil can be used, but the massage needs to be very gentle. Like we apply lotion to our body, the same way the baby needs to have gentle massage. Keep it for 2 to 3 minutes and then bathe the baby off. Bathing products, preferably liquid soap, and any product you're going to use for your baby, do a skin patch test in the form that you can apply that product on a particular hand or single hand of the baby. Wait for 24 hours. If the baby doesn't have any rash, the product is very much safe to be used for the entire body. At birth, we do give vaccination regarding BCG, hepatitis B, and oral polio vaccine. Those are absolutely safe, and the baby won't have much issues related to it. Uh, Almost all the babies do have physiological jaundice to start with from second day onwards, which is going to increase in the this thing strength by around third to fifth day of life, and then later on it's going to drop gradually. We actually can start with question answer session. It was just a gist about what you should know in a newborn in the initial few days of life. So I want Seema, if you want to ask some questions.
Yes, we do have a particular question to ask. Like, what is the thing that you should avoid when you get a newborn home?
Yeah, so the visitors' numbers needs to be restricted. It may not be many people touching the baby every time. Kissing on the lips and closer approximation to the face should be avoided, especially because we are into a pandemic, which is COVID pandemic going on. So definitely, whoever is going out needs to take proper precautions. And before touching the baby, please hand wash and then only touch the baby. Do not kiss on the lips or any close approximation. Mother can cuddle the baby, definitely. She can give kangaroo mother care to the baby, but definitely not close approximation.
Okay. So what is the care to be taken when the baby is very cranky? कोई कोई बच्चे होते हैं जो सुबह से लेके शाम तक cranky रहते हैं, रोते रहते हैं. So what is the reason and what can mothers do in that situation?
Yeah, so there are various reasons why the baby is cranky or crying. First of all, if the baby is feeling wet because if the baby has passed urine or stools, so you need to take care whether my baby has passed urine or stools, just clean it and keep the area dry so that the baby's crankiness reduces. If your baby is hungry, he might give you certain signs wherein because of hunger cry, he's being cranky. So you might have to support the baby with breastfeeding, definitely. The third reason being if they are not feeling comfortable, either with excessive wrap of the feeling cold, that time also they get cranky. So you need to cater to their demands. Maybe cuddling the baby, swaddling the baby might reduce their crankiness. A few more reasons when the baby gets cranky is because of infantile colic, which can be a tummy pain which the baby baby might be going through. But definitely you need to rule out other causes of this crankiness. And if you feel that the baby is having colic, definitely medicines would be advocated by showing it to the doctor.
ओके। सो जो बच्चे प्री मैच्योर होते हैं, प्री टर्म डिलीवरी जिसमें बोलते हैं, उसके लिए कोई स्पेशल केयर है दैट यू हैव टू जो 37 वीक से पहले आ जाते हैं, व्हाट इज द स्पेशल केयर फॉर देम?
Yes, for all the babies, including the premature babies, टेम्परेचर मेंटेन करना ये बहुत ज़्यादा इम्पॉर्टेंट है। उसके लिए जैसे मैंने आपको बताया कि हाथ से आप चेक कर सकते हैं बेबी के चेस्ट को टच करके और पाम्स एंड सोल्स को टच करके। प्रीमेच्योर बेबीज़ में जो सबक्यूटेनियस फैट रहता है वो काफ़ी हद तक कम रहता है, सो उनके पास वो एबिलिटी इतनी अच्छी नहीं रहती कि वो उनका टेम्परेचर मेंटेन करें। सो यू माइट नीड better like 2 or 3 wraps for a premature baby. Always make them wear a cap and mittens and socks so they don't go into cold stress, because if they are not able to maintain their temperature, there are chances कि उनका जो weight gain होने का phase है वो हो नहीं पाएगा, because their entire energy what they are getting through the milk will be mainly concentrating on the temperature maintenance. दूसरा चीज़ है कि हमें बेबी को प्रॉपर फीडिंग जैसे आपके डॉक्टर ने एडवोकेट किया रहेगा, स्ट्रिक्टली 2 to 3 hour ही हमें देना है। जो बच्चे 2.5 किलो के कम रहते हैं उसको हम डायरेक्ट ब्रेस्ट फीडिंग पे नहीं रख सकते, बट डेफिनेटली अ फ्यू education. There are certain supplements which we recommend for premature babies, including multivitamins, vitamin D, and calcium. As your doctor is going to prescribe, make sure that you are giving it to the baby. And definitely, mama's milk is the best milk for the premature baby. So do not go for formula feeding. Let mama express or direct breastfeeding can be advocated.
तो जो मदर्स में डिलेड ब्रेस्ट फीडिंग होती है, जो नहीं आता मिल्क, किसी किसी सी सेक्शन के बाद भी किसी को मिल्क नहीं आता, सो व्हाट इज द एडवाइस, व्हाट इज द सॉल्यूशन टू इट?
या सो देर आर फ्यू मदर्स स्पेशली एज आपने बताया सीमा कि जो सेक्शन डिलीवरीज रहते हैं उसमें हल्का सा डिले एक्सपेक्टेड रहता है एज कम्पेयर टू अ वजाइनल डिलीवरी, बिकॉज द हार्मोनल चेंजेस व्हाट हैपन इन वजाइनल डिलीवरी डजंट टेक प्लेस ड्यूरिंग द सेक्शन डिलीवरी। और जो ममाज रहते हैं जिनको जेस्टेशनल डायबिटीज मेलाइटिस का रिस्क रहता है उनमें भी हल्का सा डिलेड लैक्टेशन विच इज अ लैक्टोजेनेसिस सेकंड फेज which is expression of milk can get delayed. So in that case, putting the baby onto the breast frequently, because now your body needs to know that the baby has been delivered, because the hormonal changes are not happening in sexual delivery. So putting the baby onto the breast frequently in the initial 2 days is the most important thing one needs to go. Mama doesn't have to take tension. It is just a matter of a day wherein you need to, अगर मिल्क कम है तो हम थोड़ा फ्रीक्वेंटली फीडिंग करें, सो बच्चा का टमी हमेशा फुल रह सकता है उससे। अगर मिल्क ज़्यादा है तो इनफ्रीक्वेंटली चलता है, बट इसमें हमें फ्रीक्वेंटली फीड करना बहुत ज़रूरी रहता है। समटाइम्स वी नीड टू मॉनिटर sugars of such babies also, especially if the mother is diabetes mellitus.
So how often the baby should feed in the day? Because like all the mothers at even on the app, we have a lot of questions coming up कि मेरे बच्चे को मैं कितनी बार feed करूँ, ज़्यादा तो feed नहीं कर रही हूँ. So what is the ideal time like the baby's feed?
Yes. So in the initial, as I've discussed, because the baby is going to lose weight in the initial 3 to 5 days of life, and then the weight gain phase starts. So till the time the baby is achieving birth weight, which is approximately 7 to 10 days of life, till then we want your baby to receive every 2 to 3 hours meal. It is definitely your task to wake up a sleeping baby, but make sure that the duration, the maximum duration between two feeds can be up to 3 hours in the first 7 to 10 days of life. After that, yes, definitely shift on to full like on demand feeds, wherein the baby decides the feeding frequency. You don't have to worry. The baby might sleep for 4 to 5 hours at a stretch also, but that's not going to affect your baby, definitely.
Okay. So it was a very informative talk with you. So we have couple of users coming up with questions,
Yes,
and
ma'am.
we will try covering all the questions in the session. पर
Mhm.
जो questions answer नहीं हो रहे, doctor is available for video consultation. The link is given below in the feed. You can always get in touch with her, and I'm sure she'll be very happy to help you guys.
Yes, definitely.
Okay, so starting with one question, Swati is asking, my newborn baby is 2 weeks old and
Mhm.
she is having a lot of flaky skin. What should I do?
Okay, so if you haven't started bathing the baby, just the gist of it is you start with oil massage. Any oil, as I've recommended, just a lukewarm oil, massage the baby gently. That's going to actually, जो भी dead skin रहने वाला है baby का, that's going to take it out with bathing. But you need to soothe the skin. So with oil massage, जो extra जहाँ हमें लोशन की ज़रूरत पड़ती है वो काफ़ी हद तक कम हो जाती है। दूसरी चीज़ है, आप कोई भी लिक्विड सोप इस्तेमाल कीजिए फॉर बेथिंग रादर देन गोइंग फॉर अ soap bath, because soap bath doesn't have much of moisturizing effects, and because of friction it can actually increase the flakiness of the skin. So one is oil massage, keep it for 2 to 3 minutes and then bathe the baby with a liquid soap. That would actually sort your remedies. Any localized area of dryness, you can just on that particular area you can use any baby lotion.
Okay. Continuing with that, we also have one question. I keep on changing the diapers frequently, but yet my baby is getting a diaper rash. What is the
Okay.
reason behind that?
Yes. So first of all, the frequency of diaper changes needs to be maximum duration to keep one diaper is 4 hours. After that, you need to change. That's very good that you are changing the diapers very frequently. The other reason why the babies do get diaper rash might be just formula feeding. So sometimes what happens, as I have discussed, that one breast at a time. Let the baby empty out the breast completely. If you are giving two breasts at the same time, like in 5 minutes right side and 5 minutes left side, so your baby might be receiving more of only formula, which is very high in water and lactose concentration. Lactose is one substance which can actually precipitate diaper rash. So that is one of the reasons wherein the babies might get this diaper rash. Some of the babies do have a very sensitive skin. So what you can do is you can use any nappy rash cream with a thick layer of application so that the friction can be prevented with diaper, or can opt for a diaper brand change also. So if that particular diaper may not be soothing your baby. So these are few reasons wherein the babies might get diaper rash. So if any of the thing is there, you can try and report it completely.
Okay. So the next question is something that even I have heard in my family. If you
Mhm.
don't wrap your baby, the hands and legs might not be, like would have a deformity. How true is that?
No, that's absolutely not true. See, there are certain times wherein the baby needs a cozy environment, wherein you will keep the baby wrapped. Especially with bathing, they feel very cozy and they want themselves to be wrapped. But yes, definitely there are some points wherein they want their limbs to be open so that they can move in. It's like a play for them. So you need to have this movements also for the baby. So every time the baby doesn't need wrapping up. Sometimes the baby needs to be kept open, especially during a sunny day, wherein the baby can actually utilize the activity and it's like a play portion for them.
Okay. So
Yeah.
there is Nikita asking, do I need to sterilize the bottles and the pacifier every time after the use?
Yes, it is very much important. As a pediatrician, I'm actually totally against pacifiers in bottles, but yes, there are some certain instances wherein we also have to think about it, whether to give it. Pacifiers, because if they are kept, like if they aren't kept properly, that might actually introduce infection. So it will be always better that we sterilize bottles and pacifier after every single use, preferably in a boiling water for around 10 minutes, and normally it gets sterilized. But before putting it in the boiling water, we need to clean it with a proper brush. So there are certain brushes for particularly nipples and the bottles. So we need to clean it thoroughly, then sanitize in a boiling water for 10 minutes, and then air dry, and then you can use it.
Okay. So Swati is again asking, my baby has got mild cold,
Mhm.
the 2 week baby. What
Mhm.
should I do?
Okay, so basically, it's quite a myth that every time the baby has having like very unusual sneezes in between, whether it is cold. So sneezing is a protective reflex. So anything tickling into baby's nose, the baby might sneeze it out. If there is frequent sneezing, if there is runny nose, and if there is nose block, we can consider that the baby is suffering from cold. But if it's infrequent sneezing, it doesn't mean that the baby has got cold. It might be just a protective reflex to clear out the nose completely. If your baby is having nose block, which might give rise to a noisy breathing, then there are certain normal saline drops in the market, which can be used, and they're absolutely safe to be used as many times as you want. So do not panic. It will clear. Yeah.
Okay, so my next question is, how often should I bathe my baby?
Yeah. So because it's winter season going on, if your baby is a term baby, a healthy one, then definitely you can bathe the baby every day. But preferably the duration of the day, like the time of bathing, cannot be early morning or late evenings. It needs to be between 11 to 1 or 2 o'clock in the afternoon, because that is the time wherein it is sunny and doesn't have much of low temperature. So the risk of hypothermia, which is like getting the baby low temperature, is very much low. So you can bathe the baby in a cozy bathroom, then again immediately dry up the baby, and then you can wrap the baby and keep the baby.
So this is one of the favorite questions for all the mothers. Like, how do I get my baby sleep at night?
Yes.
This is very
So,
difficult.
yes, I know. Being a mother myself, I've gone through it. So you cannot change that habit. Let the baby change the habit. It will be really not good if you try to change it, because the babies will get more cranky and may not sleep whatever they're sleeping in the daytime also. So let the baby decide when the baby wants to change this particular diurnal cycle of them, because when the baby is in the tummy, the mother is working throughout the day. So the babies, they do get rocky motions, and that's why they sleep more during the daytime. And the same pattern they follow once they are born also. So it might take 3 4 months for them to change the pattern. Like if we are sleeping for 20 years during the night, it's going to be really tough for us also to suddenly change this pattern. So give them some time. They'll be definitely changing their pattern slowly. But we cannot do that, and we should not do that.
Okay. So the next question is also, I guess, a myth. Like, I have to cover my infant's head 24/7. It has to be either with a hat, a cap. Is this true or it's again a myth?
No, actually, especially in the winter, yes, definitely it would be better, because the head of the baby has got the largest surface area, and the maximum heat loss is via the head. So, if your baby is low birth weight, if your baby is premature, definitely a hat is recommended. For a full-term baby, if the baby has got good amount of hair on the scalp, it's not completely needed every time. You can give that hat-free times during the daytime, definitely.
Okay.
Yeah.
So my next question is, Seema is asking, I want to take my baby out for a walk. My baby is 1 month old. What protection should I use?
See, for a 1 month baby, the babies are not able to hold the neck at this moment. So whenever you are carrying the baby, you need to support. Yes, definitely you can take baby for a walk. That's not an issue. But yes, definitely support the neck completely. Make sure that because of the COVID pandemic, don't take the baby out on a crowded place. Yes, but definitely in the nature, wrap the baby properly. Maybe put a hat if you are going in the early morning times or the late evening times, and then you can definitely take the baby for a walk.
Okay. So I'll go with one more interesting question is, how do I bond to my baby and how do I make my family bond to my new baby?
Yeah, so one way to bond with the baby, mama, they bonded very nicely because of breastfeeding. The other way you can bond with the baby is to have constant conversation with the baby. They're very much familiar to the voices which they were hearing when the baby was in the uterus. Okay, so those people definitely they can bond very well. The other way to bond is to give skin to skin contact. So this kangaroo mother care, which is a component of skin to skin contact with the baby, mother can definitely give, but also the family members can give. So there is something called as father kangaroo mother care, or grandmother or grandfather kangaroo mother care. This is the best way to bond with the baby.
Okay. So my next question is, my baby is suffering from cradle care. Is it normal and what is the care to be taken?
Yeah, so cradle cap is very common to have. So what I would recommend, if you are excessively using oil on the baby's scalp, the main reason being there is a myth that whatever portion which we call it as anterior frontal, it is the soft area on the baby's head and the top of the head. So that is basically the skull bones are not completely fused. So many times our grandparents they give us the opinion that you put more of oil onto that particular portion so that the skull bones get fused early. But actually that is not right, because God has given that portion for the brain to expand. Where the maximum brain growth is going to happen in the first 2 years of life, and that particular portion, which we call it as anterior frontal, that's going to close by 18 months. We do not want that area to be closing early also. So if you are trying to use excessive oil on the baby's scalp just to close the bones of the skull, that is not needed because that's going to take time to close. Excess use of oil itself is one factor which can make the baby scalp prone for dandruff and thus giving rise to cradle cap. दूसरा है आप कोई भी बेबी शैम्पू इस्तेमाल कर सकते हैं. You need to make sure that the flakes are being taken off gradually. It should not be a forceful this thing, but if you stop using excess oil on the baby scalp and use a gentle baby shampoo, all these issues will get sorted soon.
Okay.
Yeah.
So we're done with all the questions. In case we've missed the question, I'm repeating again. Doctor is available for a video consultation. You can click on the link below and have her connect with you for all your doubts or any other consultation that you might need for your baby. So thank you, doctor. I'm sure
Thank
it was a very informative session. Please take care of your babies. Do what doctor has said. Do you want to say anything more, doctor?
It was a lovely session, and being the best host I have had till today, that's really nice of you. Thank you, Seema, for this wonderful session, and thank you all the viewers who have seen. And whatever questions you face during this beautiful journey of parenthood, I'm always available, even on video consultation platform as well as at physically presence at Motherhood Lullanagar Hospital today. Thank you so much.
Thank you. Thank you, all the users, and stay connected. Thank
Thank
you,
you.
doctor.
Thank you.